Welcome back to the channel. Today, we're diving into an important topic: how lupus can affect your hands. If you or someone you know is dealing with lupus, this video is a must-watch. Lupus is a chronic autoimmune disease that can affect various parts of the body, and the hands are often a target. We're going to break down 3 surprising ways lupus can impact your hands, from joint pain to skin changes and even circulation problems. Make sure you stick around until the end of the video, where I'll give you some tips on how to manage these symptoms so you can keep those hands strong and healthy. Let's get to it. One of the most common ways lupus affects the hands is through joint pain and swelling. This can be one of the earliest signs that something is wrong, and it can significantly impact your daily life. You might notice this pain in your fingers, knuckles, wrists, and even the small joints in your hands. These areas can become tender to the touch, making simple tasks like buttoning a shirt or holding a pen feel like monumental challenges. It can feel like aching, stiffness, or even a burning sensation. This discomfort can be persistent or come and go, often flaring up during periods of increased disease activity. So why does this happen? Well, lupus is an autoimmune disease, which means your immune system, which is usually your body's defense system, mistakenly attacks your own healthy tissues. This misguided attack can lead to widespread inflammation and damage. In the case of lupus and your hands, the immune system targets the lining of your joints, causing inflammation. This inflammation is not just a minor irritation. It can lead to significant pain and long-term damage if not properly managed. That inflammation is what leads to the pain, stiffness, and swelling you might be experiencing. Over time, this can also result in reduced mobility and deformities in the joints if left untreated. Now you might be thinking, okay, that's great to know, but what can I do about it? It's a valid concern, and taking proactive steps is crucial. And that's a great question. First and foremost, it's crucial to talk to your doctor if you're experiencing any kind of joint pain. They can help you determine whether lupus is the cause and develop a treatment plan tailored to your needs. Early diagnosis and treatment are key to managing lupus and preventing long-term joint damage. Your doctor may order blood tests, imaging studies, or other diagnostic tools to get a clearer picture of what's happening in your body. Your doctor might recommend over-the-counter pain relievers like ibuprofen or naproxen to help reduce inflammation and ease the pain. These medications can be effective for mild to moderate symptoms. In some cases, they might prescribe stronger medications like corticosteroids to suppress the immune system and get that inflammation under control. These medications can be very effective but often come with their own set of side effects. But medication isn't the only answer. There are lifestyle changes and home remedies that can also make a big difference. There are also things you can do at home to find relief. Simple measures can sometimes provide significant comfort. Applying heat or cold to your joints can work wonders. Heat can help relax muscles and soothe stiffness, while cold can help reduce inflammation and numb sharp pain. Heat can help relax muscles and soothe stiffness, while cold can help reduce inflammation. Alternating between the two can sometimes provide the best relief. Experiment and see what works best for you. Everyone's body responds differently, so it might take some trial and error to find the most effective method. Gentle exercises and stretches are also your best friends when it comes to managing joint pain. These activities can help keep your joints flexible and reduce stiffness. Keeping your hands moving can help maintain flexibility and range of motion. Simple exercises like stretching your fingers, making a fist, and rotating your wrists can be very beneficial. Think about it. If you don't use it, you lose it. Regular movement can prevent your joints from becoming too stiff and can help maintain their function. Now, I know it can be frustrating dealing with joint pain, but remember, you're not alone. Support groups and communities can offer emotional support and practical advice. Millions of people with lupus experience this symptom, and there are ways to manage it and live a full and active life. With the right approach, you can find relief and continue to do the things you love. Now let's talk about another way lupus can manifest in your hands: skin rashes and lesions. These rashes can be quite varied in appearance and severity, making it essential to understand their different forms and how they can affect your daily life. Lupus can cause a variety of skin issues, and your hands are often a prime target. The skin on your hands is delicate and frequently exposed to environmental factors, which can exacerbate the symptoms. One of the most common rashes associated with lupus is called a malar rash, also known as a butterfly rash. This rash is not only a hallmark of lupus, but also a significant indicator for diagnosis. It gets its name because it typically appears across the bridge of the nose and cheeks, resembling a butterfly's wings. This distinctive pattern can help doctors identify lupus early on. While it's more common on the face, it can also show up on other parts of the body, including the hands. This can make everyday tasks uncomfortable and sometimes painful. Another type of rash you might see is called discoid lupus erythematosus, or DLE. This form of lupus primarily affects the skin and can lead to more chronic skin issues. DLE causes red, scaly patches that can be thick and raised. These patches can be particularly stubborn and may require ongoing treatment to manage. These patches can appear anywhere on the body, but they're often found on the face, scalp, and yes, you guessed it, the hands. The visibility of these rashes can affect self-esteem and social interactions. So, what causes these rashes? Well, just like with joint pain, it all comes back to the immune system. In lupus, the immune system mistakenly attacks healthy tissues, including the skin. In the case of skin rashes, the immune system attacks healthy skin cells, leading to inflammation and those telltale red scaly patches. This inflammation is a direct result of the body's misguided attempt to protect itself. Now, I know these rashes can be concerning, but the good news is that there are ways to manage them. With the right approach, you can significantly reduce their impact on your life. First and foremost, protect your skin from the sun. Sun exposure is a well-known trigger for lupus rashes, and taking preventive measures can make a big difference. Sun exposure can trigger or worsen lupus rashes, so slather on that sunscreen with an SPF of 30 or higher, even on cloudy days. Remember, UV rays can penetrate clouds and still affect your skin. Your doctor might also recommend topical corticosteroids to reduce inflammation and calm those rashes. These creams can be very effective in managing flare-ups and providing relief. In some cases, they might prescribe oral medications like hydroxychloroquine, which can help control the underlying immune system activity that's causing the rashes. This medication is often used for its anti-inflammatory properties. Just like with joint pain, there are things you can do at home to find relief from lupus rashes. Simple daily routines can make a significant difference in managing symptoms. Keep your skin moisturized to prevent dryness and cracking. Dry skin can exacerbate rashes and make them more uncomfortable. Look for gentle, fragrance-free lotions and creams that won't irritate your skin. Products with added fragrances can sometimes cause additional irritation. And here's a simple but effective tip. Avoid harsh soaps and detergents. These can strip your skin of its natural oils, making it more susceptible to irritation and dryness. These can strip your skin of its natural oils, making it more susceptible to irritation and dryness. This can lead to a cycle of irritation and flare-ups. Opt for mild, fragrance-free options instead. These products are designed to be gentle on sensitive skin, helping to maintain its natural barrier and prevent further issues. Chapter 3. Raynaud's phenomenon, when your fingers change color. Let's dive into another way lupus can affect your hands. Raynaud's phenomenon. This condition is not just a minor inconvenience. It can significantly impact your daily life. This condition affects blood circulation to your extremities, particularly your fingers and toes. When blood flow is restricted, it can lead to a range of symptoms that are both uncomfortable and concerning. Now, you might be thinking, what does blood circulation have to do with lupus? It's a valid question, and the answer lies in the nature of autoimmune diseases. Well, remember how we talked about lupus being an autoimmune disease that can affect various parts of the body? This means that the immune system, which is supposed to protect you, mistakenly attacks your own tissues. In the case of Raynaud's phenomenon, the immune system attacks the blood vessels that supply blood to your fingers and toes. This attack can cause the blood vessels to narrow, reducing blood flow. This can cause your fingers to change color in response to cold temperatures or stress. The color changes are often dramatic and can be quite alarming if you're not familiar with the condition. You might notice your fingers turning white, then blue, and then red as blood flow returns. This sequence of color changes is a hallmark of Raynaud's phenomenon and can help in diagnosing the condition. Along with the color changes, you might also experience numbness, tingling, or pain in your fingers. These sensations can be quite uncomfortable and may interfere with your ability to perform everyday tasks. So, what triggers Raynaud's phenomenon? Understanding the triggers can help you manage the condition more effectively. Well, cold temperatures are a big one. Exposure to cold can cause the blood vessels in your fingers to constrict, leading to the characteristic color changes. Think about stepping outside on a chilly day without gloves, or even reaching into the freezer. These everyday activities can trigger an episode of Raynaud's phenomenon. Stress can also trigger an episode, as can smoking and certain medications. Managing these triggers can help reduce the frequency and severity of episodes. Now, I know it can be alarming to see your fingers changing color, but the good news is that Raynaud's phenomenon is usually more of a nuisance than a serious medical problem. However, it's important to be aware of the condition and take steps to manage it. However, it's still important to talk to your doctor if you're experiencing these symptoms, as they can rule out any other underlying conditions. Your doctor can also provide guidance on how to manage the condition effectively. Managing Raynaud's phenomenon often involves avoiding triggers. This means being proactive about keeping your hands warm and reducing stress. Keep your hands warm, especially in cold weather. Wear gloves and mittens and consider using hand warmers for extra warmth. These simple steps can make a big difference in managing the condition. Wear gloves and mittens and consider using hand warmers for extra warmth. Layering up in cold weather can also help protect your extremities from the cold. If stress is a trigger for you, find healthy ways to manage stress, such as exercise, meditation, or spending time in nature. These activities can help reduce the frequency of Raynaud's episodes. And here's a simple but effective tip: avoid caffeine and nicotine. These substances can constrict blood vessels, making Raynaud's symptoms worse. Opt for decaffeinated beverages and try to quit smoking if you haven't already. Taking these steps can help you manage Raynaud's phenomenon more effectively and improve your overall quality of life. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and information. Remember, knowledge is power. Understanding how lupus can affect your hands is the first step in taking control of your health. Be proactive, talk to your doctor, and don't hesitate to seek support from loved ones or online communities. Stay healthy and take care.